Dyspnea, causes and prevention. Dyspnea is the medical term for shortness of breath, sometimes described as air hunger. It is an uncomfortable feeling. Shortness of breath can range from mild and temporary to serious and long-lasting. It is sometimes difficult to diagnose and treat dyspnea because there can be many different cases. It is a common problem. According to the Cleveland Clinic Center for Continuing Education, 1 in every 4 people who visit the doctor have dyspnea. Symptoms. Dyspnea can happen as a result of overexertion. Spending time at high altitude or as a symptom of a range of conditions. Signs that a person is experiencing dyspnea include shortness of breath after exertion or due to a medical condition, feeling smothered or suffocated as a result of breathing difficulties, labored breathing, tightness in the chest, rapid shallow breathing, heart palpitations, wheezing, coughing. If dyspnea occurs suddenly or if symptoms are severe, it may be a sign of a serious medical condition. Causes. An episode of dyspnea is not always directly related to an individual's health. A person can feel short of breath after intense exercise, when traveling to a high altitude, or going through major temperature changes. However, dyspnea usually relates to health problems. Sometimes it is just a case of being out of shape, and exercise can improve symptoms. But dyspnea can be a sign of a serious health issue. According to Dr. Stephen Walsh, the most common causes of dyspnea are asthma, heart failure, chronic obstructive pulmonary disease or COPD, interstitial lung disease, pneumonia, and psychogenic problems that are usually linked to anxiety. If shortness of breath starts suddenly, it is called an acute case of dyspnea. Acute dyspnea could be due to asthma, anxiety, pneumonia, choking on or inhaling something that blocks breathing passageways, allergic reactions, anemia, serious loss of blood resulting in anemia, exposure to dangerous levels of carbon monoxide, heart failure, hypotension, which is low blood pressure, pulmonary embolism, which is a blood clot in an artery to the lung, collapsed lung, hiatal hernia. Dyspnea is also common among people with a terminal illness. If a person experiences shortness of breath for over a month, the condition is called chronic dyspnea. Chronic dyspnea could be due to asthma, COPD, heart problems, obesity, interstitial pulmonary fibrosis, a disease that causes scarring of the lung tissue. Some additional lung conditions may also cause shortness of breath. Examples are CROP, traumatic lung injury, lung cancer, tuberculosis, pleurisy, and inflammation in the tissues surrounding the lungs. Pulmonary edema, when too much fluid collects in the lungs. Pulmonary hypertension, when the blood pressure in the arteries to the lung rises. Sarcoidosis, when clusters of inflammatory cells grow in the lungs. Shortness of breath has also been linked to the following heart problems: cardiomyopathy, a range of diseases affecting the heart muscle, heart rhythm problems, heart failure, pericarditis, when the tissue that surrounds the heart becomes inflamed. Triggers. Environmental pollutants such as chemicals, fumes, dust, and smoke can make it more difficult for people with dyspnea to breathe. People with asthma may find that exposure to allergens such as pollen or mold may trigger episodes of dyspnea. Some pollutants such as tobacco smoking are self-administered and preventable. COPD refers to different obstructive lung diseases. This include emphysema and chronic bronchitis. All these conditions make breathing much more difficult. Not everyone with dyspnea has COPD, but 90% of people with COPD are tobacco smokers at one point, according to the COPD Foundation. Complications. Dyspnea can be associated with hypoxia or hypoxemia, which is a low blood oxygen levels. This can lead to a decreased level of consciousness and other severe symptoms. If dyspnea is severe and continues for some time, there is a risk of either temporary or permanent cognitive impairment. It can also be a sign of an onset or worsening of other medical problems. Diagnosis. A doctor will usually be able to diagnose dyspnea based on a complete physical examination of the person, along with a full description of their experiences, according to Dr. Walsh. A person will need to explain how and when their attacks of dyspnea started, how long they last, how frequently they occur, and how severe they are. Doctors may use chest x-rays and computed tomography or CT images to make a more specific diagnosis of dyspnea and evaluate the health of the person's heart, lungs, and related systems. An electrocardiogram or ECG may help to show any signs of a heart attack or other electrical problem in the heart. Spirometry test to measure airflow and the patient's lung capacity. This can help to pinpoint the type and the extent of an individual's breathing problems. Additional tests can look at the level of oxygen in a patient's blood and the blood's capacity to carry oxygen. Prevention. Individuals with dyspnea can take measures to improve their overall health and give themselves more breathing room. This include quitting smoking, avoiding second-hand smoke where possible, avoiding other environmental triggers such as chemical fumes and wood smoke, losing weight, as this can reduce stress on the heart and lungs and make it easier to exercise, both of which can strengthen the cardiovascular and respiratory systems. Take time adjusting to higher altitudes, ease into activities gradually, and reduce exercise levels at altitudes above 5,000 feet. When to see a doctor. Sometimes shortness of breath can be a sign of a life-threatening condition. Emergency medical treatment is needed if an individual has any of these symptoms: sudden onset of severe dyspnea, loss of ability to function due to shortness of breath, chest pain, nausea. Not all cases of dyspnea call for immediate medical treatment, but shortness of breath can indicate serious medical problems. Medical advice is needed if an individual experiences a change in their ability to breathe. increasing limits on their activities due to breathing problems, difficulty breathing when lying down, swelling in feet and ankles, fever, chills and a cough, wheezing,